Hello, everyone. My name is Josephine Roach, and I am a breast cancer advocate, speaker, author, and most importantly, a 6-year breast cancer survivor. I started these YouTube videos to go through my breast cancer journey with you and help those who have been recently diagnosed or going through their breast cancer journey to help them, and that hopefully something that I say in these videos will resonate, and hopefully you will understand that you aren't alone and the things that you are going through, I went through. And that would hopefully give you a sense of calm and also a sense of strength, knowing that if I got through it, you can get through it too. On the last video, I talked about chemotherapy and one of the most devastating side effects, hair loss, and what it meant to me. Today, I want to continue talking about the hair loss a bit and some of the other side effects that I encountered. Now, not everyone will be encountering these same side effects that I had. We're all individual and we all react different to medications. Now, my chemotherapy medication was called Taxol. And again, I want to say that my type of breast cancer was triple positive, meaning positive for estrogen, progesterone, and HER2. It was stage 1 invasive ductal carcinoma. And that was my treatment and my type of breast cancer. As I mentioned in previous videos, there are so many different types of breast cancers, stages, and treatments. This is a glimpse into what my treatment was like. So, as I had said in the last video, I had written a book about my journey. It's called Josephine's Journey, A Breast Cancer Survivor's Story of Hope. And I want to read an excerpt from this book. And this is about some of the side effects that I had. As I look back on this day, I realized that the hair loss overpowered so much of what was going on at that time in my life. Seeing my hair fall out was not easy. One day, anger engulfed me, and I started pulling out the hair from my head. And I screamed, "Look at this," to Jim, my husband, and threw the large clumps of hair on the floor. It was one of the most disturbing parts of my cancer journey. As I said in the journal entry that I had written previously, it was a relief to get my hair shaved off. Some people shave their hair off before their chemo even starts. I guess for me, in some way, I thought maybe it wouldn't be so bad. So I waited to see how bad it would get before deciding to shave it off. I was surprised that my hair started falling out almost to the day the oncologist said I should expect it would. You not only lose hair from your head, but everywhere. It grows on your everywhere that it grows on your body. The only positive is that I did not have to shave under my arm or legs for several months. Although this was difficult, it was not the only side effect I encountered. I had loose bowel movements throughout treatment. I began getting a metallic taste in my mouth, so food did not taste good. But I did maintain my appetite. I would joke and say, "Leave it to me, a cancer patient who cannot even lose weight." To my surprise, I never vomited and rarely was nauseous. I had a parched mouth and constantly drank water. My nose was dry and had clotted blood coming out of it at night. Unfortunately, the steroids made me very cranky, which was a huge downfall for those around me. About 3 days after chemo, I would begin to feel better. As chemotherapy continued, I experienced peripheral neuropathy, numbness and tingling of the hands and feet. After the treatment, some of the neuropathy reversed, but some was left in my toes. There are so many different chemotherapies used for cancer treatment, and the side effects differ from one person to another. This is a glimpse into the window of what I experienced. So those were some of the things that I experienced in addition to the hair loss. And like I said, you may experience different side effects because your chemotherapy may be different from mine. And I do know there are other chemotherapies that cause a tremendous amount of nausea and vomiting. And again, I know that oncologists will prescribe medications to help with the nausea and the vomiting. Those, like I said, those things, the other side effects, like I mentioned, were bothersome, but they were all manageable. The, dry mouth, I would sometimes suck on lemon candies, hard candies, and that would help. And that would also help with that metallic-y taste in my mouth. And then I would drink water. I would drink, at least 8 glasses of water a day. And like I've said in previous videos, I exercised. I would walk every single day in my basement because it was winter. I would just do laps and I would walk 20 to 30 minutes. I put in a pair of earbuds and listen to some of my favorite music, and sort of that would help with my fatigue because I was getting that exercise, and that helped as I went through my treatment. And I did walk every single day of my through my treatment, and I do believe it did help with my energy level. Although I was pretty tired after I would get home from my chemotherapy treatments and would typically just lay on the couch for the rest of the day and rest. The clots that came out of my nose, again, were just from the dryness, the overall dryness in my whole body. And that would be, again, disheartening, to see. But, again, I got through it. I think also when you lose hair, you lose, again, hair in your nose. So that's hard too, because sometimes your nose will run uncontrollably because there's not those little mini hairs that are in your nose to sort of catch it. So again, that's another side effect. And again, I want to reiterate that even though all these things, sound uncomfortable, I did get through it. Once I was through with chemo, my hair started growing back, and it came in different. It came in thicker, coarser. I had dyed my hair previously. It wasn't this color. This is my natural color. It came back mostly gray, and I decided to keep it and not dye it. And I'm happy with the way it looks. So I decided, why dye it? Again, I was becoming more conscious of chemicals and reasons as to why. Maybe I got cancer. Again, I don't know why. Nobody knows why we get cancers. But I thought I wanted to start living a more healthy lifestyle and start looking at things more closely. And that's probably what I will be talking about next, is what I started doing after receiving my cancer diagnosis and really looking at my health, because I don't think I know I wasn't healthy as far as what I was eating, and the lack of exercise, and I knew wasn't at a healthy weight. So in the next videos, I'll start talking about what started changing and how I decided to take, again, control of my health and move forward to a more healthier lifestyle after I got breast cancer. So again, a tip would be to try to do things more healthy with your life, uh, and do all that before you get a diagnosis, not of just breast cancer, of anything, diabetes, hypertension. Looking at your diet and your exercise regimen and living a healthier life. Unfortunately, I got that wake up call after I was diagnosed, and I wished I had been healthier prior to getting breast cancer, but I believe, healthier today. And I want to say to those who are watching that think about it. Think about living a healthier lifestyle now before any types of diseases can occur. So I appreciate that you listening to my video today as I explained some of the side effects that I encountered. And if you liked what I said or you resonated with anything, please write a comment below on this YouTube video. Share it if you feel that you know somebody who could benefit from what I am talking about, and subscribe to this channel. I appreciate you listening, and I hope that what I'm saying to you is helping. Until next time.